Welcome to the deep dive. Today, we're digging into a set of notes about a virus that's surprisingly common, Parvovirus B19. We've got this material here, the kind you'd use to get up to speed fast on a medical topic, maybe for revision, maybe just, to understand it better. And our goal today, let's really unpack this, pull out the absolute essentials, and help make this information stick for you.
Exactly. We'll walk through the details, highlight what's really key, connect the dots for you. So you leave with a solid grasp of Parvovirus B19, its many faces, and why it actually matters. Okay, let's get into it.
Okay, so first things first. What exactly is Parvovirus B19?
At its heart, it's a virus. A tiny one, actually a single-stranded DNA virus. It's the specific cause of, Parvovirus B19 infection.
And it's not rare, is it? The notes say it's pretty common, often showing up as Erythema infectiosum in kids.
Absolutely. That's probably its most famous presentation, Erythema infectiosum. You might notice fifth disease.
Or slap cheek syndrome. That one definitely sticks in your mind.
It does, yeah. And it's key. That bright rose-red rash on the cheeks is really characteristic of that specific illness pattern. But, and this is crucial from the notes, while it's common in children and causes that distinct rash, it can hit people of all ages, and it can look very different depending on the person. It's definitely not just a kid's rash illness.
Right. So much more than just the slap cheek. The notes mention quite a range from, a bit of a fever to some really quite serious problems.
That's right. The consequences can vary hugely. Things like aplastic crisis in certain people, joint pain, sometimes persistent infection, and really significant issues if someone gets infected during pregnancy. The notes even mention it can look a bit like rubella sometimes, which is a good reminder that rashes can be tricky. It's actually fascinating how one single virus can have such different effects depending on who it infects.
How do people actually catch this? The notes mention a few ways.
So the main way, according to the notes, is through respiratory droplets. Someone coughs, someone sneezes nearby. But it's also spread through blood transfusions, which is important. And vertically, that means from a mother to her baby during pregnancy.
Okay, so breathing it in is common. Who's most likely to be exposed or get sick?
Well, the notes point to close contact with someone who's infected. Think crowded places.
Like schools, daycares, places the notes mention.
Exactly those places. And healthcare settings are also listed as a risk factor, probably because, potential exposure in hospitals or clinics.
Okay, so once it gets in, what does this virus actually do inside the body? How does it cause all these different issues?
This is where it gets really interesting, physiologically speaking. The notes explain that Parvovirus B19 has a very specific target. It goes for the red blood cell precursors.
The young cells, the ones that are supposed to grow up into red blood cells.
Precisely. They're the bone marrow. The virus infects and destroys these precursors. And by doing that, it basically disrupts the whole red blood cell production line.
Leading to anemia, potentially.
Correct. That suppression of erythropoiesis, just the fancy term for making red blood cells, that's key to understanding some of the really severe complications, especially in people who already have issues making red blood cells, like, say, sickle cell disease. The notes mention this shutdown lasts about a week, typically, and the notes also say it can affect joints and skin, too, which explains some of the other symptoms we see, like the rash and the joint pain.
Since rashes and feeling a bit under the weather are so common, I bet Parvovirus B19 gets mistaken for other things quite a bit.
Oh, absolutely. Which raises the important question, how do you tell it apart? The notes actually list quite a few conditions that can look similar. So for that classic childhood rash, erythema infectiosum, you've got to consider things like rubella, measles, scarlet fever, roseola, even drug reactions, or, more seriously, things like meningitis or septicemia, but they usually have other major signs.
So you need to look for those specific clues, right? Like the notes hint about swollen glands for rubella or Koplik spots for measles.
Exactly right. Yeah. Paying attention to those specific details from the notes is absolutely vital for, narrowing down the possibilities. And then for older kids and adults, especially if they have joint pain along with a rash, the list gets even wider. The notes mention things like acute rheumatic fever, allergic reactions, other viral rashes, even Lyme disease, disseminated gonococcal infection, EBV, and various rheumatological disorders.
Wow, okay, that is a broad differential. So how do you nail the diagnosis? How do you confirm it is actually Parvovirus B19?
Well, the notes are pretty clear on this. While your clinical suspicion, what you see in the patient guides you, you really need laboratory testing for confirmation in many cases. We'll get to those tests shortly.
Is this something that just shows up whenever, or does it have, a season?
The notes tell us it happens all year round, actually. but it does tend to have a peak time, usually late winter and early spring.
And who is most likely to get it, age-wise?
Well, it can hit any age, but the notes say it's most common in children, specifically those aged about 5 to 15 years. But here's an interesting bit from the notes. About half of young men and women already have antibodies against it, which suggests, a lot of people get exposed, probably mildly or without any symptoms at all, by the time they reach young adulthood.
That reminds me, the notes also mention the incubation period. How long after exposure do symptoms start?
Right, for the rash illness, Erythema infectiosum, the incubation period is typically somewhere between 4 and 20 days before that rash actually appears.
Okay, let's dive deeper into what you actually see and feel with this infection. Paint the picture for us.
So the classic picture, especially in kids, is definitely that slap cheek rash we mentioned. That's the hallmark.
And where exactly does that show up? Is it the whole face?
The notes are quite specific. It's on the cheeks, yes, but, and this is key, it usually spares the bridge of the nose, the area right around the mouth and around the eyes, so not the perioral or periorbital regions. That pattern helps. Then, usually a few days later, maybe 1 to 4 days after the face rash, another rash can pop up on the body and the arms and legs. The notes say this one rarely involved the palms of the hands or the soles of the feet, which again can help you tell it apart from some other rashes. It often fades in a sort of lacy, net-like pattern.
And the notes mentioned feeling unwell before the rash appears.
Yes, often there's a mild prodrome, symptoms beforehand. Things like headache, maybe a runny nose, sore throat, bit of a low-grade fever, just generally feeling a bit off, a bit malaise.
What about that joint pain, the arthropathy you mentioned earlier?
Yeah, arthropathy, that's a really significant feature, especially in adults. The notes say it's much more common in adults than kids, particularly in women. It tends to affect the hands, wrists, knees, and ankles. And it can last, well, anywhere from just a few days to sometimes several months, which can be pretty debilitating.
Oof, months. That sounds rough. The notes also had that weird point about the rash sometimes coming back.
Yes, that's a really fascinating, almost unique quirk of this B19 rash. The notes say that even weeks or months later, things like getting warm, a hot bath, being out in the sun, heat, even getting a fever from something else can trigger a temporary return of the bright red cheeks and maybe the body rash.
So if the rash reappears later, it doesn't automatically mean a new infection.
Exactly. It's often just a sort of reaction, a flare-up linked back to the original infection. And it's just so important to remember, like the notes emphasize, the presentation varies wildly. Depends on your age, how strong your immune system is. Some people might barely notice they're infected at all.
So if the clinical picture isn't totally clear, or maybe the patient is in a higher risk group, how do we actually confirm it's B19? What are the tests?
Right. The notes state that while you often start with clinical suspicion, lab tests are the way to confirm it.
What kind of tests are we talking about?
The key ones listed are the blood tests, looking for specific antibodies, B19-specific IgM and B19-specific IgG. Finding IgM antibodies usually means you've got a current or very recent infection. They pop up relatively early.
And the IgG, what does that tell us?
IgG antibodies come along a bit later, maybe about 2 weeks after infection, but they usually stick around for life. So positive IgG generally means you've had it in the past and you likely have immunity. The notes also point out that seeing seroconversion like IgM becoming positive or seeing IgG appear or rise sharply if you test twice can be really helpful diagnostically, especially in, say, immunocompromised patients who might not make IgM reliably. The notes also mention PCR polymerase chain reaction. That directly detects the virus's genetic material.
Okay, so those are the options. But the notes also say investigations aren't usually needed for straightforward cases, right?
That is such a critical point for practical purposes. For a kid who looks well, has that classic slap cheek rash, no underlying issues, testing is often completely unnecessary. The diagnosis is pretty clear clinically, and the illness is usually mild and just gets better on its own. Testing is really reserved for when the diagnosis is murky, or in those higher-risk people, pregnant women, people with blood disorders, the immunocompromised.
Okay, so someone gets diagnosed. What's the treatment plan?
Well, for most people, the good news, according to the notes, is that no specific treatment is needed. The infection usually just runs its course and resolves by itself.
So it sounds like it's mostly about managing the symptoms then, making them comfortable.
Precisely. The notes recommend symptomatic management. That means rest, making sure you stay hydrated, and maybe some simple pain relief like paracetamol or NSAIDs if there's significant joint pain or fever.
Are there times when, medical intervention is needed, more serious steps?
Yes, definitely. The notes specify that medical intervention is for the severe cases or those complications we talked about, like the aplastic crisis. The treatment then depends entirely on the specific complication. So for severe anemia from a plastic crisis, that would likely mean blood transfusions. The notes even mention intrauterine blood transfusions for a fetus severely affected with hydrops fetalis.
And what about stopping it spreading to others?
Good question. The notes give key advice there. Prevention means avoiding contact with people who are particularly at risk, pregnant women, immunocompromised individuals, especially during the time someone is infectious. And of course, good hand washing always helps. Explaining these precautions is part of management.
Now, the notes have a really important point about when someone with the rash is actually contagious. This feels like a key takeaway.
This is absolutely crucial, especially for things like advice about school or work. The notes explicitly state, and this is worth remembering, a person is infectious for about 3 to 5 days before the rash even appears. Once that classic erythema infectiosum rash emerges, they are generally considered no longer infectious.
Wow. So kids with the slap cheek rash don't need to be kept home from school because by the time you see the rash, they're usually past the point of spreading it. That's a fantastic memory tip. Generally speaking, what's the outlook? What happens next for someone who gets Parvovirus B19?
For most people, the notes say the prognosis is generally good. For uncomplicated cases, symptoms usually clear up within a couple of weeks.
But there are definitely those situations where it's more serious, as we've discussed.
Yes, the notes really emphasize that. Complications tend to happen in individuals who have underlying conditions, particularly problems with their blood cells, or if their immune system is compromised.
So what are some of the specific complications the notes list out?
Okay, the notes list several key ones we should be aware of. First, that transient aplastic crisis, especially dangerous in people with conditions causing high red cell turnover, like sickle cell disease. That's the temporary shutdown of red cell production. Then there's chronic anemia, particularly in people who already have chronic haemolytic disorders. Fetal complications during pregnancy, that's a major concern, potentially leading to things like hydrops, fetalis, or even fetal loss. Other possible blood issues like low platelets, which is thrombocytopenia, maybe triggering ITP, or low white cells and neutropenia. And in immunodeficient patients, you can get persistent infection, chronic anemia, or other cytopenias.
The notes also mention some rarer things, maybe more surprising links.
They do. The notes list rare associations with hepatitis liver inflammation, which ties back to that mention of liver enzymes sometimes being raised. Also, myocarditis, which is heart muscle inflammation, meningitis or encephalitis inflammation around the brain, and peripheral neuropathy, nerve damage. And finally, the notes mention a potential link, though likely rare, to the development of various autoimmune diseases later on. So it just highlights that while often mild, Parvovirus B19 can have significant downstream consequences, especially in vulnerable groups. The notes really underscore why being aware of these potential issues is so important.
Okay, we have really done a deep dive into Parvovirus B19 today, haven't we? Pulled apart these notes, covering everything from that classic slap cheek look all the way to the really serious complications that can happen in specific groups.
Yeah, we've really seen how this one virus can present so differently, why it's so important to, distinguish it from other illnesses using those key features, and who really needs that closer monitoring or testing.
And understanding that core mechanism, how it goes after those red blood cell precursors, that really helps connect the dots for why things like a plastic crisis happen.
Absolutely. And knowing the epidemiology, like when it peaks and who it mainly affects, and especially that crucial high-yield point about being infectious before the rash, that's just really practical stuff to know.
Yeah, this deep dive has definitely hammered home how much there is to know about this common yet pretty complex infection.
It has, which I suppose raises an important question for you, the listener, to think about. Given everything we've discussed, its varied presentations, the potential for serious issues in certain groups where might you encounter Parvovirus B19, maybe in your studies, maybe in practice. And for whom would recognizing it and its potential complications be the most critical thing?
Definitely something to mull over as you go about your week. And look, if you found this deep dive useful for getting a handle on complex medical topics, or maybe you're prepping for exams like the MSRA, make sure you check out passthemsra.com and freemsra.com. Lots more resources there. Thanks so much for joining us for this deep dive.
Until next time.